It has been nearly 2 weeks since doctors affiliated to the Kerala Government Medical College Teachers Association or KGMCTA have been on a strike. This is in a state, ladies and gentlemen, which is known to have the best medical care in the country and has also been mentioned at the global medical world not once but several times over. But then, isn't it a travesty that medical college doctors across Kerala who had waited for some response from the government and even met with Health Minister Veena George had to perforce resort to a complete strike today? Those are the visuals on your screens. I'll come back to you. Just listen in to the sloganeering. The reason being that Veena George meeting happened but did not yield any results as the talks remain inconclusive. According to KGMCTA, the Veena George meeting drew a blank because the finance department had the final say in all matters. Now, what is the matter really? Now, for weeks, the government doctors have raised several long-standing demands, including rectification of salary anomalies at entry-level cadre, release of pay revision arrears pending since 2016, and creation of new faculty posts for new medical colleges, filling of vacancies, improving and building infrastructure and facilities for patients, as well as faculty in hospitals, resolving issues relating to pension ceiling and allowing DNS allowance or DA arrears. However, while medical services are likely to be totally impacted at other medical colleges in Kerala, services will only be partially hit in Ernakulam. I have the list of what the doctors want from the Kerala government, and I hope, unlike what the government did with ASHA workers, this time around they will wake up. I have the list with me, like I said. Now let me go across to some of the representatives and understand what the issues are. Dr. Shibu R, who's president of KGMCTA Thiruvananthapuram unit, is with us. Sulfi Nuhu, State Secretary IMA Kerala, and Dr. Rosanara Begum, who's the State President of Kerala Government Medical College Teachers Association, KGMCTA. A very, very warm welcome to all of you doctors. Great to have you today, and thank you so much for taking the time out. Let me first come to Dr. Rosanara Begum. Has the needle moved even a little? Today you struck work, and of course you are seeing to it that emergency services are not impacted. But have you heard anything from Veena George or any other government official that please come back to work, doctors, and we shall resolve the issues?
We had a meeting with the Health Minister Veena George this Monday, but we didn't get any assurances regarding even a meeting with the Finance Minister. She was convinced regarding the genuinity of all our demands, but most of our demands has to be approved by the Finance Department.
True.
So we have to have a meeting with the Finance Department, and we need an assurance from the Finance Department itself. Otherwise, we can't go back from the strike.
Okay, so you're saying you have to hear. So let me now go across to Dr. R. Shibu. Dr. Shibu, I want to ask you the first instance or first demand that I have a list with me, Doc, is that you want a pay revision at the entry cadre of assistant professors. You say there is a pay revision. Can you explain to the viewers what is the revision like and why should the revision happen? Are you fearing that people will not, join the medical teaching profession? What do you fear? And what is the pay revision that you're demanding, doctor?
Yes, the last pay revision for medical college teachers came in 2015. And that has an anomaly in the entry cadre. That means the doctors who have joined after 2016 will have a dip in pay of around 10,000 in broad specialties and around 14,000 in super specialties. And another anomaly is that before the 2016, it was 7 years for an assistant professor to become an associate professor. And NMC says only 5 years. And all private medical colleges, an assistant professor becomes an associate professor within 5 years. In government sector, it was 7 years for us in Kerala state. But after 2016, it became 8 years. They will increase the period, promotion period. So we want it to be at least 7 years, or it should be actually it should be in the 5 years, because NMC
Now
says only
8
5 years.
years, you will settle for 7 years. Is that what you're saying, doctor?
Before that, it was 7 years. Okay, we'll settle for that. But at least this is an this both are anomalies. One is the entry cadre pay level that is decreased. Another is this increase in.
How much has it decreased, doctor? I want the viewers to know this. How much has it decreased?
10,000 per month for a broad specialist and 14,000 for super specialty faculties. That's that much dip is there in the salary. That much decrease.
That is a lot of money.
And because of this, many new entrants are coming. They will just join, and after some period, they just leave off because they are getting more money in the private sectors.
Yes, that's
true. Because we need more time for promotion. We get more salary and more workload due to there is lack of faculties in all departments.
Yeah, Dr. Nuhu, I don't understand. This is a government which talks about power to the people, talks about how governments and PSU should be encouraged more. They talk about capitalism, they talk about private enterprises, but always their ideology has always, worked somewhere else to the left. Why am I even mincing words? What is this attitude then? I want to ask you that if arrears, let's talk about equality, Dr. Sulfi Nuhu. If in 2016, the salary revisions happened for all government employees, no? Why is it that the doctors did not get the revised pay despite the central government and every other government telling us that we should, actually throw petals on you, you are God themselves on earth and everything else? What is the problem here? Is it like, I know that Kerala went through a great, the state exchequer was running empty. But what is with this so-called policy, as it were, more than anything, the intent, as it were?
Yeah, basically, there is a gross injustice to the government medical college doctors. As far as you know, that this is almost 1.5 to 2 lakhs per annum they are losing. And the other thing is that that in the entry cadre there are a lot of vacancies, and there is always a makeshift arrangement. When there is a vacancy, there are some remote medical colleges like Idiki, Wayanad, Kasaragod, and all. What they do is they just pull some doctors from major medical colleges like Trivandrum, Kozhikode, and all, and they place those people at Idiki and all those remote places to get the sanction from the NMC. So what happens is temporarily they will get that thing, but there are no infrastructure there, no staff pattern adequate for the teaching purpose, not even patients in some hospitals, in some medical colleges, surprisingly. And what happens is that somehow they manage this thing, the acceptance from the NMC and all. But basically, the doctors are overworked and they are underpaid. And this is a gross injustice. The basic thing is that the health sector in Kerala, like for just similar to the what is happening in the central government sector also, then the Kerala government also, they are allotting less financial support to the health sector. That is the basic issue. During the budget session, during the budget, they give the WHO says it's 4%. Indian Medical Association, we are requesting at least double the amount to the health sector, at least 2%. Now it is just 1% is being given to the health sector, and this is grossly inadequate. See, we take the issues of health sector or maybe the health of the people as the primary thing, and we give less money. So that doctors, they are suffering, but they cannot do strike. I am absolutely sure that Dr. Shibu and Dr. Rosnara Begum, they both will agree that they don't want to do the strike. No doctors want to do the strike. They are forced to do the strike because they are underpaid, and it's a gross injustice. Just because of the payment or the financial allocation for the health sector is grossly inadequate, not only in Kerala, cutting across Kerala and in some parts of the world. We have to change that, and what happened during the COVID days and all. We need to give more attention towards this health sector, not only for doctors, other supporting staff also. We need to give more support for those doctors, and we need more financial support for the health sector. That's a basic issue here.
All right. Dr. Roshanara Begum, I want to come to you. Dr. Roshanara Begum, the thing is that everyone is going to throw the guilt trip at you and said you took a hypocritical oath and people are suffering because, correct me if I am wrong, your emergency services are still working. But then overall, OPD patients, other patients who have chronic diseases, autoimmune diseases, they all must be suffering because of this strike. So, are you saying that unless Veena George comes and talks to you and tick marks every little demand, you will not end this whole day strike? Is that what you're saying, Dr. Roshanara Begum?
Actually, we have started this active strike from July 1st, Doctors' Day. And initially, we were not hampering any patient care services.
Right.
For the last 3 months, we gave ample time for all the discussions and the decisions, but no decisions were taken, no discussions, only unofficial meetings happened. So we were waiting that they will take a decision in our major demands. And during that time, what happened is the new medical colleges at Wayanad and Kasaragod got the letter of permission. And even NMC is not looking into the deficiencies, even infrastructure deficiency or staff deficiency. And government medical colleges, they'll get the attendance report from all medical colleges. We are all registered in NMC and they know from which medical college you have been transferred and for how long. So NMC is also playing blind role in this. So the LOP was given and the students were admitted, 50 students each in these two new medical colleges.
Yeah.
But still, there was no move from the government to create adequate posts in these two medical colleges, let alone the previous two medical colleges at Koni and Idiki, where we are suffering with gross staff deficiencies in the clinical side.
So I want
where
to,
the students are already studying.
Yeah, Dr. Roshanara, I also want to bring to your notice, the Trivandrum MCH. It is in a state of complete disarray. There is complete disturbance there. Patients are lying on the floor. These are critical care patients. One patient apparently allegedly died while he waited for his cardiac treatment. Two patients are sharing one bed. There is a lack of everything. I mean, there is a lack of doctors. That's a given. But there is lack of infrastructure, lack of equipment. I mean, we also have a case of equipment earlier, urology department. Is that also an example of how government hospitals have become in Kerala, madam?
See, when the patient load increases, naturally the infrastructure should improve, the staff strength should improve, and the way, as we go into a cultured society, the way we behave to the patient and the dignity given to the patient is very important. So we have to improve the infrastructure. So our strike is not only for doctors, it is for the public also. Because we have to improve the system further and give adequate services to the patients.
I want to ask you, November 10th, which is like what, 3 days ago, there was a notice and 44 additional doctors were given, apparently, correct me if I am wrong, for Kasaragod and what was the other place for Kasaragod and Wayanad?
Wayanad.
Dr. Shibu, this question is for you. So don't you think the needle is moving, Dr. Shibu?
Yes, definitely it is moving. That is maybe because of our previous 3-day strike. We have boycotted the office for from October 20, and it was a relay strike. That means one day Monday, next week Tuesday, and next Thursday, Wednesday. Then only after this, this new order came out with 44 faculties. But that also is not adequate because that is associate professors and only professors. There is no post for assistant professors were created, and whichever post was created, it is not designated which department. Only some numbers are given, numerically. So adequate assistant professor post also should be created.
Okay. Now let me go to Dr. Nuhu. Dr. Nuhu, there seem to be multiple problems, but I'll tell you what. You know, the thing is that what do you do if they are unable, because there was a time when Kerala was unable to even pay pensions of people who deserve it more than anyone else. There was a time when the government could not pay, you know, teachers, professors. Now, I want to ask you something, that much like what you felt, that it is not really Veena George, but it is in the hands of the finance department, maybe the finance minister of Kerala. You know, I want to ask you that how do you see a way out, sir? If you do not see patients, they may bring private doctors for some time, but then those clinics will also suffer. So it's a kind of, will have a domino effect. How do you see, what is the way out of this, Dr. Nuhu?
Yeah, definitely. It's a tough question, but definitely there were suggestions like this. The thing is, basically what happened is there is a gradual increase of number of patients coming to the government sector in the last 10, 20 years, 15 years or so. So there are more people coming to the government sector, and then less doctors and less infrastructure. And what happens is that we have to accept this. We have to accept this. We are giving free of cost treatment to everyone, even to the richest people coming to the government sector. We need to charge them. There are some charges, but this is grossly inadequate. What happens is, unfortunately, if you charge 5 rupees or maybe 2 rupees for an OP ticket, there will be a big agitation in front of the hospital for charging 2 rupees for the OP ticket. We need some funds. Definitely, we need to mobilize that also, at least from the rich people, maybe the people above the BPL category, APL category. We need to get money from them, and we have to mobilize financial thing for the government sector also. Otherwise, the government may not be able to provide the entire fund for the government sector. So we need to mobilize funds. Maybe one of the things, probably the easiest and genuine thing, is that we need to charge people who can afford, who are coming to the government
No,
sector.
but how do you
That's the
decide
one way.
that? Dr. Nuhu, how do you decide I can afford it and someone else can't? I mean, what is the method?
There is an income certificate. There is a ration card. There is a BPL certificate. There is an APL certificate.
Right.
There are easy ways. But the thing is that there is no willpower from the government or maybe from the bureaucracy to take up the challenge. We need to say that we need to improve the medical sector, the government sector. So we need more money. So that's why we are charging the rich people or maybe the people who can afford. That decision has to come from the man, probably from the administrators and the ministers who have a vision for a long-term vision. Otherwise, they will just succumb to the pressure from the media and the public, and they will withdraw that 5 rupees charge. That is the thing what is happening in not only in Kerala, in many parts of the country.
Very well said. You know, Dr. Roshanara Begum, what Dr. Nuhu said was very right, because there have been strikes in Andhra Pradesh. I've covered that. There have been strikes in Telangana, government doctors. They all saying that it is very unfair on us. First of all, I mean, there was one case where the government turned around and said, but you chose government service. No, did I put a gun to your temple? You could have, after medical college, after doing your MD, opened your own clinic. You come here and then you complain. Dr. Roshanara Begum, how fair is that argument? Tell me, ma'am.
Ma'am, during my joining time or during the time I studied, the best of the brains opted for medical colleges because this was a passion. Teaching, research, patient care with all specialities, it was a passion. But now what happens is that the entry cadre, even the pay loss is there, like Dr. Shibu said, with the current DA rate for super specialties, it is around 32,000 per month. And for the broad specialties, it is around 20,000 per month. So they are losing that much amount, and the entry cadre duration of promotion is also increased. So what happened, whoever is coming into the service, they are not remaining here. They'll go just after 1 or 2 months. And even when you call a PSC for many super specialties, you can see that no one has applied for the PSC test for the medical college services. So where are we leading to? We should make the entry pay and the services, that means how they can work there, their conditions for working, everything you have to improve. Then only the new generation will come. And we will get the best of the doctors in our medical colleges. Creating more doctors doesn't lead to excess of doctors and overflow into the medical colleges. That is a bad dream, actually.
Dr.
Because we
Shibu.
should think positively.
All right, Doctor. Dr. Shibu, very well said, Dr. Roshanara. Dr. Shibu, I want to ask you something. In the first, I want to understand why were the salary reduced? What is the reason given, Doc? Government, after all, cannot possibly, arbitrarily order something like this. What was the logic behind it? Because if my salary was reduced, it means that I am useful, but I am not that useful. I mean, what does this mean? Why was it done in the first place, Dr. Shibu?
I think Dr. Rosnera may be the right person to say that.
Dr. Roshanara?
He was a top.
Yes, ma'am. In the 2006 pay revision, we were granted the UGC AICTE pay scale. So what happened is we adopted the pay scale and modified accordingly for us. This pay scale was followed in all the pay revisions. That is, our pay revision happens 1 in 10 years. For other state employees, it is every 5 years. And in the 2016 pay revision, before that, what happened is, initially, for the pay correction, they have given 5 increments for the super specialty degree holders and 3 increments for the broad specialty degree holders.
Okay.
So what happened, UGC, when they changed the norms for PhD, MPhil, everything, they have withdrawn the advance increments given.
Right.
So citing that, they have cut our advance increments, and even the pay fixation was erratic, because everybody lost 3 increments equivalent in the pay fixation.
That's really serious, Dr. Roshanara. I mean,
probably the doctors are soft targets. They are soft targets. They can't do the strike always. Probably that is one of the reasons.
I mean, that's very well said, but it's so sad, isn't it, Dr. Nuhu? Because first they did it with ASHA workers. Now you're saying doctors are soft targets. I mean, is it that they have kind of almost nearly shut down the shutters when it comes to both? Because ASHA workers are the backbone of the rural health system, as we all know very well, and doctors are the backbone of any state. So this attitude which you say they are soft targets because one day or the, will they come back because they have nothing else to do or no other job to be found, or are they doing because they have a guilt?
Yeah, that has to be seen. Probably the government must take a proactive step in this thing, especially not only for this thing. The government sector, the entire payment thing, and the financial support, they have to take a new stand. Then only we can correct this issue, and probably the next pay revision also the same thing will happen. We have been seeing the same strike pattern probably for the last 10-15 years or the 20 years. Every now and then the government doctors are forced to do some strike to get their very justifiable pay. That is very, very unfortunate.
Right. And Dr. Nuhu, I want to ask you and describe to the viewers the life of a government doctor after 10 years being in the medical profession. I mean, what I understand is nightmarish, but over to you. Tell me the number of hours that a doctor puts in, and how does it pan out, Dr. Sulfi Nuhu?
Yeah, just forget about 10 years. I'm having more than 25 years of experience in the government sector, and now I see almost 300 patients in an OPD. You know that 300 patients in an OPD extending from 8 a.m. to 1 p.m. and I can barely give less than maybe less than a minute for a patient, maybe some 50 seconds, 20 seconds. This is absolute nonsense. We cannot give proper care for this patient. We need to have more doctors, maybe 3 shifts now, 3 times at least 3 times the number existing now, so that we can give adequate care. So thing is, they are less paid. They do not have adequate promotional opportunities. They do not have even securities. The doctors are being attacked in the government sector and also in the private sector. So it is also happening. So they are dragged into any kind of strike. And also, I will say that even there is an issue of death of a patient. Indirectly, if you look at it, we can say that it's due to the lack of treatment or the lapse of treatment, but unfortunately, we have to say that this is, the one patient was he was forced to lie down on the floor. That is because there is lack of infrastructure only. The more patients are inside and there are no beds. So that is the situation, and we are facing it.
But Dr. Nuhu, and I'll come to other doctors also. Dr. Nuhu, there is also an argument that you work till 1 o'clock, not you, but generally, you finish by 1 o'clock. At 4 o'clock, you sit in your house and have a private practice. They say that don't go by what they are saying. Do you have an answer
No,
to
no,
that?
no. Actually, the government doctors are not, the government medical college doctors are not allowed to do the private practice. Definitely, the government health sector doctors are allowed as per the rules. So I think that should be dealt in a democratic way, or maybe there are some certain rules for the private practice and all. That should be strictly implemented. If someone is doing a private practice, you should not punish everyone for that. So if some medical college doctors are doing practice, you have to take action for that. Basically, and personally, I feel that the private practice must be allowed to even to the medical college doctors, because it was the cheapest and best treatment available for the middle class. It was banned there, and there is no alternative. The total number of doctors, the total infrastructure and the doctors number, it has not increased, and many are forced to go to the private sector because of that, the ban on the private practice. But thing is that if there is a law of the land, everyone are supposed to obey the law of the land, and they cannot go at 4 o'clock at home and do the practice. If there is anything like that, the legal action must be taken. Having said that,
yeah.
you cannot decrease the salary and other infrastructure.
Yeah,
for
which is
that reason.
well, Dr. Roshanara, why didn't you go to the court? I mean, there is a court in this country. You could have gone to the court and petitioned. How can you reduce the salary like this, ma'am?
Madam, we are going to the court. There are so many cases in similar UGC and medical education in various courts, including Supreme Court against the government. But government is filing appeal in each cases, and the cases are going on.
Dr. Shibu, I want to come to you before I let all of you go. Dr. Shibu, tell me something. What is the future course of action? How do you see it? Do you think you'll all go back to, you will keep protesting, but most of you will get back to your chambers and start practicing? Of course, emergency services are still on. But how do you see tomorrow morning panning out? How does it unfold for you, Dr. Shibu?
Definitely, we will be intensifying the strike, because we don't feel that some person who are striking now will go back and sit comfortably, because everyone is it's their right to get their arrears, and also it's their right to get the entry error anomaly corrected. So the strike will be intensified in due course.
All right, Dr. Nuhu, as someone who heads up IMA, what is the role of IMA in this?
Yeah, Indian Medical Association Kerala State Branch has declared total support, or probably the unconditional support for the striking doctors, because it is a very justifiable demands. Definitely, we will have discussions with the KGMCTA leaders, and we will give adequate support as and when required. We have declared the open support, but then the future course of action will be decided depending upon the discussions with the KGMCTA leaders.